welcome everybody to this EEHRxF webinar, Click and Share, and EEHRxF. So we're going to be talking about transforming health data access for patients in Europe, the yellow button experience within the European health data space. And we're very excited to see so many people joining us this afternoon. My name is Jana Rasmussen. I'm Chief Consultant with Medcom, who is the Administrative Coordinator of the EEHRxF project. And on behalf of the whole consortium, welcome today. We will start off by some, you could say, housekeeping rules. So we are recording this webinar, and we will be posting this on the project website and on social media channels. So we recommend you are, I think, already all muted, but in case you also don't want to be recorded visually, please turn off your camera. But we're also very happy for you to keep it on so we can see who is attending today. There will be time at the end for questions and comments. Please write your question, your comment in the chat function, and we will pick them up during the Q&A session at the end. You can also allow subtitles or captions here in Zoom, and below on your screen, you're able to show captions if you want to do that. And the next slide, please. Yes. We have a fantastic lineup for you, and you will be presented about the speaker before each session or each presentation. So for now, we will move on to a little kickoff with a Mentimeter that we hope you will join, so we get a little sense of who you are out there and what your starting point is for this webinar theme today. So please scan the QR code, enter the code and answer our questions, and we'll be bringing up the Mentimeter results as they come in. We are starting to see, we even have Canada here. That's fantastic. So we're definitely going beyond Europe as well, even though I do see a lot of European countries, but lovely to see so many countries being represented as well, the United States as well. There's also apparently a country, I don't know the one with the numbers, but at least then I might learn some things today. So very excited to see that we are reaching so many countries with this webinar. That's excellent. Ooh, fitness trackers, that's a good one. I see many of you are far better about this. Sorry, Catherine?
Hi, I saw Dubai in the list.
This is interesting. We're having almost not quite a 50-50, but I see I'm not the only one not actually wearing a fitness tracker or having yet. So excellent. Thank you, everybody. Vaccination record. This will be very interesting, I think, to see. I'm really looking at the I Need a Miracle one. That's that will hopefully change. So, but interesting to see. Quite a nice actually division here in terms of some definitely have a very easy access to it, while others is still dreaming. I see of that scenario. That's great. Thank you very much, everybody. I mean, there are actually 6 in under a minute. That's well done, actually. So 5 minutes to 1 hour. Okay. Well, there's still work to be done out there. That's for sure as well. Even though there are those who already have excellent systems. That's great. Thank you, everybody. And I think we will we'll pass on the word to our first speaker, Catherine Kronacki, who is also not just the director of the HL7 Europe, but she's also the scientific coordinator of the EEHRxF project. So please welcome Kathleen.
Thank you, Yane. I must say that I was one of with the miracle, and I was also one that wears a fitness tracker, and I am zooming in from Greece, and I'm looking for my slides. Okay, what is EEHRxF? EEHRxF is an innovation action, and the aim is to expand the format to share and effectively use your health data within the European health database. There are 3 pillars in EEHRxF. The first is for you all, the yellow button, so that you can click the button in apps, in health portals, in anything that is patient or citizen facing, and get your data and use it to get creative insights. Maybe merge your own data from your tracker than the one that I'm wearing, or through corrections, amendments to the data that come from the health system, and use that to learn more about your health and maybe enhance it if necessary, or find more better ways to be healthy. The second is the hub, because we want this to last. We want to be able to be sustainable and support the implementation of the EHDS with an inclusive and sustainable way. And the last one, you need a sign. You need a sign to recognize what it looks like to be able to have the capability to manage your data in high precision. That's the label. So very quickly, the vision, everyone can share their health data in the format with a click of a button, and that will make the EHDS reach potential. The second one is the mission, what we do. There are 6 priority data categories in the EHDS regulation. Are those enough to meet your needs? We will be experimenting with evolving specifications to identify priority data categories and collaboratively prepare the digital health community for accelerated adoption, because we would like to see this happen, us controlling our health data, uploading, downloading, having the smart link that you see there within our lifetime. And we have very specific goals. The goals are the button, but it's also systems that can talk to each other and be able to exchange data in high precision. It's the hub to maintain these tools and make it easy and cheap for the industry to implement and be part of the EHDS. And the label, as I said, which is to demonstrate the commitment, the capability of products to implement the format. Our initiative, EEHRxF, comprises from standards organization, as you see in the slide, 6 of them, the hub governments, but also the industry, Digital Europe, MedTech Europe, EUCROF, so that we can make the yellow button a reality and the data that we have be high quality and precision. But we do have also some concrete priorities. The first one is to demonstrate the impact of EEHRxF across continuity of care, clinical research, and population health, so that citizen science becomes a reality. We start with 8 adoption sites, but we would like to expand to 75 additional ecosystem partners and accelerate adoption across Europe, and demonstrate together safe, trusted, low-cost sharing of high-quality structured data, so that we can show the value of bridging healthcare, population health, and clinical research. This will allow to facilitate movement of digital health services across Europe and global user standards, drive Europe's competitiveness in AI and the health data space, and also incubate the hub as an accelerator of global standards with the European Electronic Health Record Exchange format at the center. So in a nutshell, there are 6 priority data categories in the regulation. We are exploring IPS for research and care plans, but also telemedicine, and we will be able to download, one-time share, and link with smart get links, maybe even on paper, our data in high precision. That's the vision. we have a community of excellence, and we have a call for early adopters that's for you to join. Next slide. And with that, I would like to pass on the floor to Professor Enrique Martins, who will share with us more about EHDS. Enrique, the floor is yours.
Thank you. Thank you very much, Catherine and Sarah. It's a pleasure to participate in this Click and X Share webinar, and I'm trying to make sure that I manage to move the slide on my side. Okay. I found it. In a nutshell, European Health Data Space for citizens means primary use. So when you go to a doctor, you go to an appointment, someone asks you questions, someone writes about you. This traditional usage of information systems and data is what the European Health Data Space calls primary use. So we're supporting the delivery of care. So when, of course, you don't know if you have a vaccine or not, and you are accessing that information, that is supporting the delivery of care, because you check, oh, I've got to take it, so you book that. Secondary use, it's all about using data for other purposes. So, policymakers, they have to make decisions. Should we open a hospital here or there? Should we get more specialists in this area or in this other area? Researchers need to find out about, our health, to find new treatments, new approaches, and so on. And of course, many people remember COVID. There's the best example of public health interest. And then an area that is not so obvious for the everyday citizen, but easy to understand. So if you imagine that your data is stored in softwares, in hospitals, in primary care centers in the country at the national level, you wonder, what are these softwares like? Do they follow regulations? Do they follow rules? How were they built to make sure that your data is safe and also can move around the healthcare system in your country, but also around Europe and even outside of Europe? This is what we call requirements for these electronic systems. So the same way, you would not like to have a boiler in your house that you're not sure if the people building boilers follow the regulations. So you want someone to define regulations, and you want someone to come and verify if these boilers, for example, or your car, maybe is an even better example, has been designed for purpose and it's fit for purpose. So you want to make sure when you enter a car that everything works, and you don't know the rules. No one knows all the engineering requirements that the car manufacturers have to comply to. And the same way, you as a citizen, you do not need to know many of the things that we discuss in some of these projects, but you need to know that these rules exist, because these are the ways to ensure interoperability and standards to ensure what is more important. What is more important is that these systems that provide you the basis of the rights to use and see the usage of your health data for the benefit of your health and of the health of others. So the regulation goes into different details of the rights. And just as an illustration, as of 2 years from March this year, so the full force implementation, we start progressively, because there's different components of the regulation that enter in effect in different times. But as Catherine just exemplified, you will have the right to access, see your data, but also download the copy of that data. But for example, also provide a copy of that data to someone else or to another system. And of course, it would take us a long time to discuss these rights, but what is important for you to understand today is that some of these rights are made possible due to the work that XShare is doing, but also in a simplified way, in easy language, with the so-called yellow button. And within technical discussion, and I know the audience is very variant, you then need to know, so what are the key standards, the key rules that I was just explaining that really are important? So they are called the interoperability component and the logging component. When you combine these two, imagine these two parts of the machinery of the car. Okay, one provides the capability of data to move between different systems, different software in hospitals, across countries. It's called interoperability component, and it has different categories of data, which means that maybe in the beginning, we're not capable in Europe to share all the data across all the systems. So we have defined priority. And then the second component is called the logging component. And this basically means to allow you to know who has accessed your information, when, and where. So imagine the system, and these already exist in some countries, where you get an email or you get an alert. Okay, Dr. So-and-so, nurse so-and-so has accessed your record. But now imagine that that system, that capability is now mandatory, because for now it was optional. Some countries have it, others not. And now it becomes mandatory, but also harmonized. So even if a Greek doctor or Greek nurse sees your data and you are in Lisbon, the same would apply. And then finally, the idea that this regulation is not a big bang. It's not going to happen from one day to the other. There's progressive implementation, and for all of you that have to get ready to this, and all of us as citizens have to get ready, because we have to get ready to demand, to require, to request, to force, to ask our hospitals, do you comply? Are you ready? And if not, we need to exert, as I normally call it, these digital rights. That called health data activist movement is really key. But for you to understand, so there's a very complex steps. We have to detail the regulation in concrete instructions for the different actors of this complex ecosystem to know what they have to do. And with this, the very brief overview of the regulation for every one of us, I would like to hand over to Professor Evangelos for continuing the journey. Thank you very much.
So thanks a lot, Henrika. Let me make sure that I can control the screen and the slides. Yes, it works. So thank you very much. In the next, say, 20, 25 minutes, I'm going to talk about the health journey perspectives of data-driven healthcare. Okay, we are talking about the European health data space. What is it? The European health data space is a new EU regulation that protects health data. You can think of the European health data space something like the GDPR of health data. And now you may wonder that we already have GDPR that protects the data, so why do we need another regulation, the European health data space, to protect again the data? Why? Well, there are several reasons why we need a new regulation, and in this presentation, we are going to talk only about two of these reasons. The first is that the European health data space enables citizens to download their health data, be careful here, from all hospitals and laboratories they have visited in the past in a machine-readable format. These are important aspects, and we're going to explain them later. And second, the European health data space accelerates research in medicine. That means that, like, data collected for primary care, that is, when you go to the doctor, when you have a lab test, when you have a blood test, when you collect data about you, this data now can be utilized for secondary purposes as well, like research. Research for new drugs, for better health care, for early diagnosis, etc. So these are the two important dimensions. The European health data space enables citizens to download their health data and accelerates research in medicine. As a regulation, the European health data space gives citizens several rights. The first right is the right to access your data. That is, the right to access their personal electronic health data in the context of primary use and free of charge, in an easily readable form. I'm going to explain about this form later because it is important. It's what we call the format. Second right is that citizens have the right to receive an electronic copy in the European Electronic Health Record Exchange format. Citizens have the right to insert their electronic health data. They have the right to request rectification if the data are not correct. They have the right to give access to a data recipient of their choice, like their spouse, their child, or whomever else. They have the right to restrict access of health professionals, and they have the right to view access logs, much like Enrique said previously. That is, to obtain information on the healthcare providers that they have accessed their data. Now, with the European Health Data Space, citizens can download their health data. For the first time in history, they can request all their data from all providers in a format that can be easily read by computers. This means no more paper, no more handwritten notes, no more misplaced lab results, no more lock-in with a single hospital. I told you that the data are downloaded in a specific format. Actually, the European Health Data Space states that you should receive your data in a specific format called the European Electronic Health Record Exchange format. Because the name is kind of long and kind of difficult, we call it the format. And the format is based on existing standards like HL7 FHIR. That word that you see here, FHIR, the FHIR, we pronounce fire, like the fire. So HL7 FHIR has two important properties. The first is that it is human readable, simple ASCII text. People can read it. Although it can be long, it can be thousands of lines long, it's simple ASCII text. And the second and most important property is that HL7 FHIR is machine readable. That is, computers can read, process, and transfer this format. Now that we explained a little bit about the European Health Data Space, you may have questions like, I can download my data from my hospital today. What more will the European Health Data Space do for me? Well, the European Health Data Space enables users to download all their data from all providers, not just a single hospital, but all public hospitals, all private hospitals, all diagnostic centers, labs, all of them. Wherever they are medical data of yours, you can download them. And you may also wonder and say that my hospital sends me my lab results in PDF. What more can the European Health Data Space do for me? Well, PDF, and especially scanned documents in PDF, documents that in paper format that we put in a scanner and then convert it to PDF, cannot be really understood by computers. Computers can print it, but they don't understand it. That is, computers cannot extract the health data from a PDF documents because PDF documents do not specify which text corresponds to medical information like surgeries and lab tests. PDF documents can be printed, but they don't contain that metadata that say this information is about a surgery or this information is about a test. On the contrary, the European Health Data Space requires hospitals to give your data in a machine-readable format in HL7 FHIR that contains this metadata, and you can see what are the lab tests, what are the surgeries, etc. You may also wonder, that is, okay, I downloaded my data in the format. Well, what can I do with those data? Well, for the first thing, you can visualize the whole picture of your health. You can compare and analyze your health data over time. Like, how has my cholesterol changed over the past 10 years? If you try to answer this question today with paper documents, it will probably take you, 20 minutes, half an hour to assemble all these documents and create a graph. But with the European Health Data Space, it's a click of a button. It's a query to a database. You can do it in seconds. You can answer other questions as well, like in 2024, I traveled a lot for work. How did this traveling impact my cholesterol? How much weight did I put on then? Is my body weight related to cholesterol, etc.? You may also wonder, okay, I can have a full picture of my health data, but is there anything else I can do with my data? Well, lots of things. The sky is the limit. You can send the data to a specialist doctor abroad asking for a second opinion. The system can automatically translate it if the doctor speaks a different language. You can avoid duplicate and expensive lab tests when you go to a new hospital and they request more tests or all tests from the beginning. You can show a prescription to a pharmacist translated in a local language in a different country and get the right medicine. You can share your medical record with your family, that is, for medical history purposes, like genetic disorders, etc. You may also wonder, okay, I downloaded my data in the format, I can understand the uses of it today, but are there any future or futuristic uses that this will enable? Of course, you can connect to wearables and smartwatches. That was our first question in the Mentimeter. So you can connect your medical data to your fitness data, that is wearables and smartwatches, and get a holistic pictures of your health and fitness. Today, everybody's talking about AI, artificial intelligence. So you can use AI health assistants. They can suggest preventive care. They can suggest exercise plans based on your health profile. They can answer questions and provide personalized answers just for you. They can evaluate alternative therapies like which therapy is more suitable for you. And ultimately, you can create a digital twin. And a digital twin is a personalized replica that assists in managing your health. So you say that, yeah, that's very useful information, but I see lots of data flying around from hospitals to data centers and from data centers to my local devices, and all this data be moving around. Is that secure? Can I feel safe about the security of my data? Well, yes, it is highly secure because it is fully aligned with the General Data Protection Regulation. You own your data, and you have the right to access, control, and limit its use. All data access and processing activities are logged and monitored, much like Enrique said earlier. You can see who accesses your data, when, and why. And that will happen for the first time in history for the entire EU. Also for secondary use, that is research using your data, secondary use happens only when after an application process. That is, not everybody can access your data, only vetted researchers will be able to access your data. And that access will happen within a secure processing environment. They cannot download your data in their laptop or in their desktop. No. Data processing happens in a secure processing environment, and your data will be anonymized. And in most cases, you'll be able to opt out of any secondary processing of your data. You may also wonder that I hear a lot about ransomware, and especially in hospitals. Can my data be leaked from the hospitals? Well, in the near future, hospitals will be safer than ever before because the EU is putting together a European action plan on the cybersecurity of hospitals and healthcare providers. This plan will significantly enhance cybersecurity. ENISA plays a leading role in this activity with a new support center, and the center will offer a ransomware recovery subscription service, helping hospitals and healthcare providers prepare recovery plans in advance. Finally, you may wonder, oh, this is nice, but I don't think I can afford it. How much will the hospitals charge me to give me a copy of my data? Well, the answer is simple. Nothing. Not even a cent. They're not going to charge you anything. You get your data for free in the format, in digital form, because using the regulation, it is your right to get your data. Now that we have understood the format of the European health data space, let's examine the story of a potential patient, Marina. Marina is a 40-year-old teacher who is struggling with high cholesterol. She takes care of herself. She eats healthy, she exercises, but she is missing the full picture. Lab results in paper documents they are hard to process. Sometimes they are lost, especially during house moves, and lab results, they feel like pieces of a puzzle. Marina has a lot of those pieces, that is, a lot of lab results, but she doesn't have the full picture. She doesn't have all the pieces of the puzzle. But with the European Health Data Space and the yellow button that Catherine talked about earlier, things will change. Marina is able to download all her results in machine-readable format in HL7 Fire. Marina can see her cholesterol levels over the years. She can consult foreign specialists for a second opinion, and she can join clinical trials. Marina is truly in control of her health. Marina can download her lab result, prescription, medical test procedures in HL7 Fire, and she is able to view all of them in a dashboard like this. She can zoom and compare different tests and have the big picture of her health. This is how the big picture looks like. There is the patient info, which is Marina, the medications she is taking, conditions, care plan, procedures, lab results. And if we click on one of those, say, lab results, we can see her lab results in 2010, 11, 12, 13, 14, 15, 16, and other years. And we can see results of a specific case like diastolic blood pressure, body weight, calcium. So Marina can see how her pressure changes over the year, how her calcium changes over the years, creatinine changes over the years, etc., etc. Marina can translate the results into a different language, from English to Italian, for example, to get a second opinion from a specialist in Italy. Once Marina felt in control of her health, she took the next step. She became an active user of her data. She sent a secure link to her Fire data to a doctor abroad asking for a second opinion. She received a second opinion from a specialist in that area. The specialist also recommended a web portal specializing in her condition. In the web portal, she found the latest scientific developments in cholesterol, and she started attending monthly online meetings and lectures on her condition. Marina made a significant change. She made the shift from following the instructions of her local doctor, like, take this pill and come back in 2 months. So she made the shift from following the instructions to having a deep understanding of how she needs to manage her condition, what she needs to do, and most importantly, why she needs to do it. Now, Marina is really on fire. Through the web portal, Marina found online clinical trials in cholesterol. She entered her data in a clinical trials database, asking to participate in clinical trials related to cholesterol. She was selected to be screened for a trial through her local hospital for a new experimental drug that may lower cholesterol with less side effects. So the European Health Data Space did not just give Marina the control over her data. The European Health Data Space empowered Marina to reach her full potential in the management of her health. Marina is not alone in this world. Marina has 2 children. Marina learned that high cholesterol may be related to genetics. Marina talked to her children and had them tested for cholesterol as well. They all started caring about health from a very young age. They all started exercising regularly, and the portal provided recipes for healthy meals. The portal gave advice for children and teenagers with high cholesterol. And you see, Marina didn't just take charge of her own health. Marina became a champion for her entire family's well-being. But you know what the Chinese say? That the journey of 1,000 miles begins with a single step. And Marina was able to take this first step. And the first step in Marina's journey is the yellow button. To get her data in Fire, Marina securely logs in her health system, clicks on the yellow button, and gets a link to her data in Fire in a secure server. Marina can now share this link with another application or with a doctor for a second opinion. Marina can also download her data in her local computer for later visualization and processing, much like this screen up here. Now I think we move to the next part, which is another set of questions from Mentimeter. Janne?
Yes, thank you very much, Evangelos. That was really interesting, and I hope you all learned a lot. I thought that was an excellent breakdown of the potential of the yellow button and the EHDS. Just before we go to the Mentimeter, also just an information. I think I made an error earlier referencing to the chat to use for questions. You do need to go to the Q&A function of Zoom to pose your questions. So sorry for those who may have been trying unnecessarily to use the chat. But let's go to the second Mentimeter, where we're asking you all again to do a little bit of work for us and answer some questions. So we're here looking at, what is important to you when it comes to sharing your health data. I mean, I'm not surprised seeing privacy, security, trust, confidentiality highlighted here. But very interesting also seeing things like, it has to be reliable, interoperable, well-structured, convenience, easy to use. Yes, I think we all got that. So, but there's no doubt that there's the usage part, but there's certainly also the security and privacy aspect of this is very important. I think he's still coming in. And next question. Issue of control. Do you feel in control of your own health data? So, I've got some answers. We don't have any total bosses here yet, I see. No. Glad to see people are trying their best. But still a lot of people in the dark, unfortunately. But I think that's probably no surprise. I'd like to see one, actually, who is in a complete boss of their own data. That's very interesting. Yeah. Okay. Excellent. Thank you all. And next question. So do you think the EHDS will change that for you? Will it give you even better control? I think there are a lot of people waiting, I see. I'm still trying to get a grasp of it. I don't think that's a surprise at this stage. What exactly the EHDS will do and how it will impact our control and in reality. Excellent habits. Excellent. Yes, well, that's good. We like that. Those slides. So it seems like there's probably Evangelos' excellent description of how that might actually work for people and how it can change things. You see, some still answers coming in. Yeah. Great. Thank you very much. That's excellent to see. And then we will move on to our next speaker, which is Stefano Dalbiani from, I don't speak Italian, maybe, Stefano, so you may have to mention your hospital yourself, the names are.
No problem.
Thank you.
Okay. Just few words to introduce my organization. I'm from Monasterio Foundation, which is a group of public research hospitals, tertiary center for cardiopulmonary diseases, and we are one of the pilot sites for EHRxF and an early adopter of the EHRxF button. We work with the standards and the EHR system since early 2000, late 90s. And we always wanted to give our patients something more than paper, to support their healthcare processes and also to support encounters with other healthcare professionals and general practitioners. So that's why we are really interested, and we started adopting the share button directly in our system. We have something that can be easily accessed, let me say, by the patients, because we have a portal and an app that can be used by a normal PC. So the patient can prefer sometimes to use the PC instead of a smartphone, or the smartphone directly, because it's much more comfortable, of course, to bring data around and have data in the smartphone. You can find on the right-hand side of this slide the discharge summary and laboratory report and patient summary and discharge report again that has on its side each report the share button. So you can choose which repo you want to download, because this is the first function that we implemented. And just clicking on the button that you want, you can pick the local or the position that you want to use for the download, and have the file that is the structure format that Evangelos just mentioned to be used for anything that you want. So you are really in control of that. And this is perhaps too technical, but just to show that we are not talking about paper, we are talking about data that can be processed between different servers or computers, of course, and you can just have the sense here of the patient name. So we are talking about of Marina, and we are talking about a condition that affects Marina, and that, for example, brought Marina to our hospital for an investigation. And after the investigation, or included in the investigation, we might have some kind of merging of the information that were available for Marina, usually contained in the hospital EHR, with information that are coming from the EEHRxF, from the format. So here you can see, this is in Italian, but this is the list of conditions that affects Marina as detected by the physicians. And this is something that might be easily translated, as we will see later. Again, we might have also the report, the single report that we're generating in the hospital, and this is something that we might insert directly in the discharge summary. This is the initial point, the structure format. Again, we might have a secondary usage of Marina, and that is, I skipped just one. And that is the download of the document, because this is the current functionality of the system. And in the document, that is, of course, an electronic document that is internally structured, but not structured as a list of distinct information. The document has an attachment inside. So you have the document downloaded, and within the document you have the structure format of all the information that you can give to other healthcare professionals to take care of Marina or of yourself. But this is something that can also be associated to a QR code. We talked about a QR code in the beginning. And this is a really basic implementation to let you try this. Please take a picture of that QR code now, and you should find a structure file that is technically called JSON file that reports all the structure information that we have behind the document that we are just visualizing. So this is the first usage that is capable to merge the documental part that might be necessary for certain processes with the structure part that can be used later or at the moment also to support other investigation or patient continuity of care. You can check also a visualizer of the same information. This is another example. This if you take a picture of this QR code, you can open a visualizer of the more or less the same information. This is just an example to show that you don't need, of course, to understand the structure format of EEHRxF. You don't need to know something about HL7 file, but you can use some external program or internal program within the same platform to show the information. And what you can find there is that the condition that affected Marina is translated, for example, in English. That's because we have some coding system behind the structure report, behind the hospital discharge report. So we are capable to do what Evangelos just mentioned, but on the other way around. So starting from Italian, have some translation in English or any other language that can be supported by the dictionary. So to see some live action, this is a video. The patient app is directly available from our patient portal, or you have already installed in your smartphone. You can access using an authentication code. So you need to insert here your identification code for the single patient. And you have associated a phone number here that is receiving an OTP, I mean a single key. And this is our patient portal main menu. If I click on the PDF of the discharge summary, which is the first line, you can download the report and you can read the report and show the report to somebody else. Here you have all the laboratory information, the instrumental examination, and also the discharge therapy that can, of course, be prescribed. Here you have the two QR codes that you can use just to send to somebody in front of you also the structured data to be imported in another system. But you can download only if you want the discharge report in a structured format. So this is, of course, not for patient, but just to exchange information between computers, and you can have this file locally on your PC or on your smartphone. And the same thing applies for example, outpatient laboratory report or inpatient laboratory report that is embedded within the patient summary. And here we have an example of the patient summary itself that represents essentially your clinical status. So the most important information that the physician needs to know before taking care of you, your allergies, your current medication, is included here. So this is a first example on how the information can be really used in a hospital and can be really exchanged for clinical care. So I will give back the floor to Janne to continue with the Q&A session.
Thank you so much, Stefano. That was excellent to see. And we will just, our idea was to just have I think we're going to skip, we had another Mentimeter, but I think that was just doing the same question again, just to see if what Stefano was presenting was actually maybe going to change someone's mind over the course of his presentation. But we already got a lot of positive feedback from the first one. So we're good to, for now, address questions, because we have a lot of questions we see in the question and answer session. We won't be able to make all of them here over the next 5 to 10 minutes, but we are collecting all the questions as well, pulling them together in kind of a register, and we'll try to address them in writing also afterwards. So I will pass the floor to Rhonda, who will then just present with some key questions that we can address here online.
Great,
Please,
thanks,
Rhonda.
Anna. And yes, can you hear me okay? Can you hear me?
Yes, we hear you just fine.
Okay.
Sorry, my
Good. Thank you very much, Anna. So yes, we've got 27 questions here. We're not going to get to all of them. A lot of questions about the format and FHIR and how those two work together. And then a lot of questions specifically about, what types of data and how much data, and also some questions about privacy concerns. So I'll just take a few of these. So this first one, we have here is, as the EEHRxF and next-gen EHR systems move toward full interoperability and cross-border data sharing, how are you planning to manage dynamic and granular patient consent, allowing individuals to authorize specific uses, for example, clinical study, one partner, or revoking it in real time and tracing this activity? Evangelos, do you want to take a try at this one, or maybe Stefano?
Yes, this is a very complex question. It depends on which regulation applies at this specific moment. The European health data space states clearly when patient consent, when opt-out exactly is possible by the patient. And the GDPR also explains when patient consent is needed. So the answer depends clearly on what type of application is there and which regulation applies. If I can give example for secondary accesses, for say for research, patients can opt out of a specific research and say that they don't want their data to be used for secondary use. And there are some exceptions to that as well. But let's say in general they opt out. So this is how they do it. But if some other regulation applies like the GDPR, then the process may be different. Thanks.
Okay, thank you, Evangelos. And another one, somewhat from a slightly different perspective. In order to manage access permission for health professionals, there needs to be a database with all health professionals in Europe that allows authentication. Who is providing or building this database? Is this something that needs to be considered? Evangelos, do you want to?
And Enrique has his hand up.
Okay.
Well, just a quick comment on that. First, that's not necessarily true. So we can use federated approaches. So we have the EHDS regulations, the European regulation, legal identification, and in many countries, the professionals have been identified, and we can use the identification that is managed by each country as long as we connect it in a logic. No, that's one way. And the other way is to use technologies that, for example, we are experimenting together with the EEHRxF button, where you use, for example, blockchain, and you share it with a certain professional, and you can upload attributes, other blockchain. So there's more than one way to solve that, and it doesn't need to be gigantic Brussels sitting registry where everything is there to make it work. The federated architecture is the basis of most of it.
Okay, thank you, Enrique. And here's a shorter question, it's pretty practical. To download data from each of the providers or hospitals, we will need to click each type yellow button. Can we clarify how that will actually function for a user?
That was just a sample implementation, because this is something that we chose to give the full control of what you have downloaded to the patient. But we have several choices. I mean, you can just have some kind of checks to select the different documents or the different data set and download everything as a big package. I mean, perhaps too big package, but you can do that. Many times the patient identify the data to be downloaded with some report or some document. So that's why we are still maintaining this kind of correspondence between IPS and the structure format, discharge report and the structure format. But I mean, it is in the specification or technical specification that you can put everything together and deliver everything that you selected to your preference healthcare provider.
Thank you, Stefano. And we had a couple of questions about the use of standards. So I'm just going to take one of these and hopefully that will cover. I think we got 2 or 3 of them. So here's a question. Since we already have the FHIR standard in place, why do we need new standard or format like the EEHRx format? Can't the FHIR standard meet those needs for the EHRxF yellow button?
Yeah, can I respond? Or okay, Catherine.
Yes.
You go, Catherine.
Catherine, yeah.
That's a very interesting question. Unfortunately, standards are not created once to be used forever. It requires a constant adjustment, trial and error, and improvement. And indeed, there is a baseline fire standard. We are in 807 developing, and actually they are under ballot right now. You can go to 807 Confluence under 807 Europe, and you will see several baseline profiles and profiles for each of the priority data categories that are under ballot. It's going to be improving because we want to reach a level of precision medicine that requires that we do very structured, very detailed description of our health data. That's what realize eventually something like a digital twin, where we can add data, the health professionals can add data, the medical devices can add data, and we can work with AIs to achieve quality insights.
Thank you, Catherine. Here's another question. Will it be mandatory?
You have
Excuse
3
me.
more minutes.
Okay.
Yeah,
I have. Go ahead.
we need, if it's a very quick question and a very quick answer, we can take it. Otherwise, we will not go to the closing statement. So,
Okay, good. Then I'll just take this last one here, which is another aspect that we haven't touched on yet. Are there any potential harms, such as discrimination or stigmatization, to consider?
Well, okay, can I take this one as well? Maybe you didn't make it clear, but secondary use of data will be completely anonymous. So data will be completely anonymized for secondary use. So with totally anonymized data, it's very difficult to do any discrimination and stigmatization. So at least the probability of discrimination will be significantly reduced because the data will be anonymized. Thanks.
Thank you, Evangelos. So we have to close the Q&A. So Jana, I'm handing it back to you. Thank you.
thank you very much, Rhonda. Thank you for keeping track of those. And as I said just before, Rhonda was posing some of the questions from you in the Q&A function, we will be collecting all the questions posed there and try to get some written answers to them. We'll also, as I mentioned in the beginning, be putting up the video or the recording of this session, and I think also the slides will be available as material afterwards. And then the final thing is just to pass on the word again to Catherine, who will do our closing remarks. Please, Catherine.
Oh, thank you. Thank you very much, everybody. I must say that there has been a little bit of stress. So, 2 minutes. To summarize, our vision is that everyone can effortlessly share their health data in the European Electronic Health Record Exchange format just with a click of the button. And this will be one of the ways that the European health data space and the digital compass for 2030, Europe's vision for a human-centered, sustainable digital future will be realized. We gave you some key points. The XR button, that is your right to control your data, to get them in a computable, rich, precision format eventually, a user-friendly feature across portals and apps. We talked to you about the data portability right that we have at the GDPR and how it becomes healthcare specific in the EHDS. We talked to you about the format, which fosters citizen engagement and drives research and innovation in the EHDS, and we make a consistent effort to connect it with public health and clinical research. What are the benefits? We aim to simplify sharing of trusted health data and foster citizen science, and there are many ways to do that, and many of your questions reflected that. We aim to strengthen the digital resilience of healthcare systems in Europe and the digital resilience of each one of us. And we aim to advance the global leadership of Europe in digital health standards. What's next? Well, we need you. We need you to be part of our community of excellence, a vibrant community of experts exchanging knowledge and creating synergies. We also very much would like to put your attention to the open call for early adopters of the yellow button, innovators, entrepreneurs that would like to show what's possible and bring our imaginations to new heights. And finally, tell us what you think. Join our survey. This is an effort that I would like to acknowledge of the EEHRxF consortium. We are a big consortium, a lot of effort, but I would like also to thank you for attending on behalf of the large team of people that worked very hard for almost 2 months to deliver to you this webinar. Thank you so much for attending.